Namaskar. We are very fortunate to have two great ladies who have been working with the people with a very unique therapy called art therapy. This is, according to my understanding, as I have understood from them, is a therapy to cure people with artistic activities. They engage people of all age, sex, and geographical locations, engaging them in the creativity, and they try their level best to understand the problem, their psychosis, their mental conditioning, their physical ability, and their intelligence. So, I welcome these two creative, sincere ladies, Srimati Sonia Bhandari, who is the founder of this art therapy, and she has been working in India very passionately. She loves her subject, discipline, and creative thing. And Spriha Mukherji, a young research scholar associated with Sonia Bhandari and Bhimans. Both of them are associated with Bhimans. It is in fact a matter of great satisfaction for me that I have been associated with them, and I have been learning this creative artistic technique to cure the mental physical illness of many sections of the society. And I think that it is one of the best needed therapies in the world. I am sure with the passage of time, this therapy will get due recognition from the authorities of India, and it will get acceptance by the people of India from all sections of society. Sonia ji, coming back to you, please tell me very briefly about the history of evolution of art therapy in India that you have been practicing. Who introduced you to this field of specialization? What are the things that you have done? How have you introduced it? And what is the level of your satisfaction? And what is this all about?
So basically, I never realized that I was using art more as a therapy for myself, and art has always been more like, I think everybody in their own childhood, pick up the colors and enjoy. But for me, I always used to use art to communicate with myself, or more like an excuse to be in isolation from the world and doodle and enjoy the accomplishment once I had made the images. As I grew older, I started participating like any common man into competitions, and charcoal sketching is a sketching with a lot of depth that is required. So that used to really take me into trance, and I really used to find it a very meditative exercise. So I became very passionate about it, and then came a time when I came across the term art therapy around 11 years back, and I'd heard of the term music therapy, and somehow I felt, I'm sure there is a term called art therapy, and I began to explore. And I basically have done my education from Bangalore, and I came to know that there's this workshop happening in Bangalore, my hometown. So it was very easy for me to just, go and attend that workshop, which was a week's wonderful workshop under the, I would say, mentorship of Ecem Beckett, a Turkish origin art counselor and art therapist, and also registered art therapist from UK. So he really conducted it very, very intensely, and he could actually see that there is something that I could take it forward, and he himself took the initiative of becoming my mentor. So I did my course, and I felt connected with it. I was already I already had a studio of my own where I was not really teaching art to the children, but I was using art to help them grow healthily, happily, joy, bringing joy in them. And somehow the parents got very well connected with me because I was actually sending back children, creating value and taking a lot of joy with them, and gradually learning art with their own potential.
A small intervention. Who is considered as the father of art therapy?
The father of art therapy is Edward Adamson from UK, and he was an artist. So he had nothing to do with psychology as such. So he had a open studio in Netherton Hospital in UK, where there were patients, psychiatric patients struck from the World War II, and he's the one who actually observed how these patients used to come to his studio and were non-verbal and coming from trauma, and they used to express themselves through art, and how even the psychiatrists began to explore the art made by these patients. And Edward Adamson actually took it as his social responsibility and he saw the changes in the patients, and he wrote a book on that called Art is Healing. And because he saw the people changing, the patients changing, healing through art, the non-verbal patients were becoming verbal and bonding with him. So he's the person who's called as the father of art therapy. And also Adrian Hill, who's
Good.
also an artist.
So now till by art therapy, what I have understood from you is a therapy in which seeing the painting, sketching and designing of the students or the practitioners, you try to understand his and her mental disturbances and illness. Now, what are those factors which encourage you to understand those things, and what are the techniques to understand those things? Like, how will you understand that this person has this kind of problem? How is, pen or brush or pencil or, a sketching style and curvature? What are the symptoms that you get from them?
So there is an approach called developmental art therapy approach, and in this there are 3 steps. So one is the sensory stimulations. The first step is sensory stimulation. The first thing you observe in the patient is art materials are kept, and the approach of the person, that whether he's art friendly, creative friendly, or whether he or she is hesitating. And so because of the way the art materials are spread around, and because of the orientation that I do, so the patients are able to use the art materials to express themselves, whether non-directive approach or a directive approach. So there are two approaches, that sometimes the patients don't want to be, they are inhibited. So through their inhibitions, they're not ready to do art because they feel that it requires skill. So I use a non-directive approach, where I tell them to do whatever they want to, the colors are in front of them. Even then, they are able to draw, whether it's even just abstract, just a splash of colors or just coloring. So colors play a very important role to analyze what exactly is going on in the subconscious mind of the client. So art therapy is actually called the window to the subconscious mind. Second step is skill acquisition. Skill acquisition is that gradually you see the development of skill in the client. That is how they're placing the images, the perspective of that drawing, whether the house in front is small or big, how the dimension of the tree is adjacent to the house. So those dimensions are also a part of the skill. So you see that the kind of pressure or the kind of approach that the client has used towards coloring, or the kind of material that the person has chosen. That is, whether it's painting, whether it's oil pastel, whether it's color pencil, all these areas help me to understand the personality of the person, the inhibitions of the person. And the third is adaptation. So gradually when you see that the client is calming down, relaxing, through the art, self exploring, and with my feedback, understanding what's going on in the subconscious mind, the person feels calm and elated, enlightened, and feels the awareness of self tends to become more evident for him or her, and that's how it one is able to actually use art therapy to understand a person or to uh, um, raise the person rather.
Great. Now I see one scope. Now I will come to you, Spriha. You see, she says this technique was initiated by a art practitioner, a painter. He initiated it. So he was a painter and he has a psychologist mind inside his body, mind and soul, right?
Yes.
Now, she is someone who has been doing it and she has been creating a sense of harmony which can be accepted by other disciplines, mainly by psychology, your discipline of specialization. Now you are working with Sonia and you are a student of psychology, you are doing PhD, and both of you are attached with a mental hospital called BAMHANS. Now you tell me how a discipline which is not essentially your discipline, but now it is helping you as a psychologist discipline, how you see the combination of an artist and a psychologist, and then traveling, keeping these two things as art therapy approach to cure the mental illness of the people. Please tell me.
Thank you so much for the question, sir. So, how I see it, because I have been inclined towards creativity, and then further I pursued my studies into psychology. So, when I see the potential of this practice in a mental health institute, where art as art as an independent practice has to be combined with psychology and brought into application to benefit people with their various concerns, I feel it has that potential to help people express themselves emotionally, cognitively, behaviorally, and most important, socially. Because it is very important for any individual to feel that if it is about expressing oneself in terms of whatever goes in the subconscious level, or in terms of whatever has been understood by the conscious mind, one should feel free to express with a mode, via mode of communication, which is firstly non-threatening, which is not intimidating at all. Secondly, it should give a free flow, a free hand to the individual to go to any extent in any way that he or she would like to. So that is where art plays a very important role, and it has made things very easy for people, especially from the mental health field, to be the participants, the clients, the patient, or someone who's practicing it as a professional, to express oneself freely without being felt threatened about it, and at the same time post that expression of it, understand the aspects of it psychologically, very minutely look into it, and finally come up with something which would help them or benefit them in a way to take this journey forward in terms of the self-development. So this is how I see the combination of art with the psychological field in terms of acting as a therapy for the individuals.
So, can I understand one thing from you, that you all see it as a psychoanalytical,
Yes,
therapy
absolutely.
of understanding or treating
The
the
human
illness
mind.
of a human illness.
Yes.
Right?
Absolutely.
Right.
Absolutely.
Now I tell you, you have been associated with women's, with Sonia. Can you very briefly give me one case study wherein a patient is transformed after coming there, after getting the treatment, after getting in touch with you people in your rapport and all those things that you have done? Can you give me one example?
Sure, sir. Would love to. So
Please.
I would share a case study of a lady, a woman, an elderly woman in her 50s, and she was facing concerns of psychosis, and she was admitted in the hospital for over a period of 2.5 months. And eventually she started participating into creative therapies. She started participating mostly into art, craft and clay. And she had self-esteem issues. She lacked self-confidence, and she had a lot of anxiety in her. She had poor concentration skills and focus, which were a part of the symptoms that she was experiencing. So when it comes to art therapy, we as a team, we always look into the potential of it, that along with the process of medication and other psychotherapy, if there is something through which you can tap into the potential of an individual in terms of helping them feel self-empowered at certain level, it helps them overcome that phase very, with a lot of convenience, with a lot of with a lot of strength, inner strength. So when she was she was taking these sessions. By the end of 8th session, she finally expressed that she could actually sit for long, wherein earlier she was not able to really sit down and do certain work at a stretch of even 20 minutes, 15-20 minutes. She would get anxious, she would get restless, she would get panicked, and she would immediately feel like going away from that place. She would even, get aggressive. So her concentration level was not at all it was not that good. But over the period of 8 sessions, she realized that how she was connecting with those activities, in what terms she was getting healed emotionally, and she finally shared that there was an improvement in the level of concentration. She could focus, she could think positive about herself all over that period of time. She was able to have a sense of accomplishment by making things, creating things, being creative. She started to look at herself in a very different way than what she used to. Her self-esteem really got improved in that way. So definitely this is the way it helps an individual deal in certain situation where they are undergoing a treatment, something like like mental health concern like psychosis, and along with the medication, when they are practicing these therapies, they are taking help through these therapies, it actually complements the process, it enhances and catalyzes the process in many ways.
Very good. Sonia ji, welcome back to you again. Sonia Bhandari and Spriha Mukherji. You have given a wonderful case study. What is the economic status of that lady? You said she was 50 years old. What is her family background? Rich, poor, very poor, or in between?
She was from a decent income generating family, and I wouldn't call it rich or very rich, but an upper middle class family.
Okay, fair enough. What do the other family members of that lady think about her after getting treated them from you?
So throughout the journey, they have been very supportive, and when they saw these changes in her, they were very happy and content about it, and they literally shared that they would like to encourage her further to continue with these creative activities even at home, and they took consultation on what kind of activities can she do, can she practice when she's back home after getting discharged from here, so that the benefit is it is always experienced in the process. Along with her medication, it continues over there, and she's able to strike a balance, because they really saw a lot of changes, and they really felt that if she would be involved into these activities along with the medication, it would benefit her in the long term.
I see it as a booster healing. Why I am using the word booster healing? Because I see with the patient, family members are also healed.
Yes, yes.
And this is your achievement. Absolutely. If you have been doing this. Now coming back to Sonia. Can you also give me very briefly, succinctly, one case study?
So this is a young man at that particular time, a 28 years old Muslim background, and coming from a lower strata economic status, and he was diagnosed with bipolar affective disorder and OCD. So when I started doing art with him, so he wanted to use a scale in everything. So I told him that scale is not allowed. in art therapy, you have to enjoy the freedom of expression. So this was the first few years of my journey of art therapy, and it was a great learning for me too. But whatever came across and however I had learned about art therapy, I began to apply all those approaches with the patients. So this patient, this particular person said that, patient said that, मैं scale के बिना नहीं करूँगा. So I said, okay, so let's make it really easy for you. So I made a dotted image, and he just joined the dots, and he felt good that I have been able to make some curves around the flower and mountains and so on and so forth. So he began to become easy in doing art, and then he got discharged. And when he got discharged, his mother came to me saying that he's again got very violent and he's getting very violent. So please, help him to be occupied. Let him come to the hospital, to be occupied. So that became my journey with him. That he came to the hospital, and what to do with him. The only thing that I could think of is that he had that creativity in him, but he did not want to acknowledge because he wanted to be a scholar. So I told him, yes, you can be a scholar. But here what I want to say is that this was the case which gave me an inclination that how to tap that creative, innate creativity in a person who's on a denial. And because creativity and mental health go hand in hand. So this was the case where I was able to have a breakthrough, that he began to see the poetry writing or a script writing as a creativity in him, if not colors. But still I had that faith in his creativity that he will be able to. Finally, he found his niche. He started writing the poetry. He started writing script. And every day he was coming to the hospital. He was involved in creative writing. And then he learned how to do quilling. And he started making the best quilling earrings. And that's how the product development in the hospital began. And that's when I realized that the second phase of art therapy is to engage a person in product development, because if a person is not able to function normally in daily life, then surely creative engagement can help the person in income generation. And he began to earn income from that. So this gave him a sense of accomplishment. So through art therapy exercises, it led him to become a vocational trainer also, and income generation through art. And he actually began to live in society without being tagged as a mentally ill patient.
Great. So it is not only that you sensitize the patient or your client, you treat them. Sometimes they give you opportunities to explore the hidden talent of them.
Yeah.
And then accordingly you module and remodule and schedule and reschedule your treatment and way of teaching and way of treating, so that their inner strength can come out and they can be connected or brought into the mainstream of the society as a professional, as a wage earner, or as a creative person. That is great. Now, one more thing I wanted to know: how do the professional communities, say doctors, psychologists, psychoanalysts, and counselor, motivators, take your specialization, like a specialization of art therapy, in the hospitals and in the other area of specialization?
It's a very good question, because I think this is where a bit of struggle is there, but I think I have in a way overcome the struggle. But yes, it was not taken very well, because under the ethics of medical science, if the modality is not incorporated in the medical books, then, and it's not a licensed practice, then we don't get referrals. So they won't send the patients with referrals. Yet with the kind of engagement that the patients began to show results in, the doctors at least began to send the patients by saying that, okay, you can engage and occupy this patient by the time the treatment is happening. That is exactly what happened with Edward Adamson. And that's exactly what happened with me. I actually lived that experience myself. So even if they're coming to engage, it became my study. And when it became my study, I began to give results, and I, in a way, won over the trust of the medical professionals. And I myself am a counselor, and so I also have my private practice. So what I realized was that in the clinical, chronic clinical environment, I began to engage the patients in art, and they would talk over art, and I began to respect and appreciate that we are working as a team in the hospital. And so I did not want to work with any kind of an autonomy over there. I wanted to be there as a team. Then, because I have a private practice, that gave me another angle of practice wherein I saw that only art therapy without any referral is coming maybe not from the doctor, but this is psychosocial issues. I was able to actually see the practice of art therapy healing. And also, I started calling it that you're not here to depend on me for solutions, but I'm here to train you in life skills. So that really helped them to connect with me as a counselor. When it comes to the clinical psychologists, well, I would say that there are very few clinical psychologists who are ready to give referrals, who are ready to, I would say, call me as their team member. But the ones who were, I really appreciate that they wanted to work as a team with me, that even if they're working with clay with the patient or whether they're doing talk therapy with the patient, when it came to the art, they were not trained in that, and they knew that I was trained in that, and they knew that this patient has a creative angle, so they would send the referral, some of them. So this has been my journey, and today I would say after 6 years of hardcore practice in the mental health, it is a peaceful coexistence.
So I have gathered from you that with initial resistance, with initial non-acceptance of your therapy, with initial objection to your therapy, finally they have started accepting you or your therapy because it is a powerful therapy. It connects the people and doctors together. Welcome back to my talk with two art therapy practitioners, Sonia Bhandari and Ms. Mukherji. She is a wonderful example. She is a psychologist, a student of psychology, did her master, and now pursuing her PhD. Spriha has started working with you in art therapy. And you said that initially her community didn't accept you in totality. They have little hesitation to accept your specialization. Now there is a girl, a sincere researcher, an explorer of psychology, Spriha Mukherji, who has working in close association with you. She has been observing your every activity. She has been with you working with your client. And she has been trying to understand the every nitty-gritty of this speciality. Not only that, she has gone many steps ahead and she has been pursuing her PhD on that topic, right? That is a total transformation kind of thing that I can see in her. Now, how do you see the relationship between two professionals who have two different, altogether different background, qualification, orientation, education, family background, city background, everything altogether. They are different. But the oppositions unite together to cure the illness of the community. She is from Allahabad, you are essentially from Bangalore, now settled in Delhi, and you are working together for a very well-known mental hospital of India called Bhimas. Please tell me very briefly about your association with her and how you have transformed her life and how she has made her impression in your mindset.
I think it's one of the most beautiful questions that you've asked me during this time, because she's extremely close to my heart. So, so I had basically started art therapy training around 3 years back, and on the request of such students.
Tell me very briefly.
Yeah, as such students. So when Spriha was among my first student, who came up to me and said that I would like to learn art therapy from you, and that's how the association began. And in that training, my main focus was that because of the resistance that I went through, I wanted to actually educate the psychology students, the future potential, and the professionals in psychology, in health and care, how that art therapy tool as a modality can really help them in their already ongoing profession. So Spriha was the first student who came to me, and that's how our association began. Now, through that training, she did not just stop there. She wanted to take it further, and she was among the first art therapy, specifically art therapy teacher, faculty in Amity.
Wait, Spriha, she says that you are going to take it as a career in your life, right?
Absolutely.
She's right?
Absolutely.
You are going to take it?
Absolutely.
How are you going to take
100%.
it? How are you going to take it?
So, I have already decided in my mind that it is only art therapy that I'm going to passionately and dedicatedly work my entire life for, because I'm going to not only I'm not just pursuing my PhD into this field for gaining more knowledge, but I also want to see in what ways can I make a difference in our society and like around the world through the effective application of the same. So I really want to take this practice to people, and that is how I really want to make my career in it. It's not just limited to attaining a degree or to doing a particular kind of a job, but it is towards that vision of helping individuals feel empowered through this
Fair
therapy.
enough. Excellent disciple of extraordinary teacher. Now, Sonia, if I tell you to give her marks out of 10, how many points would you give her?
11.
ये थोड़ा ज़्यादा हो गया. You have to restrict in 10. You tell me how.
Well, I would give her
100%.
100%.
And how many points you will give her as a teacher? And
Absolutely, 10 on 10.
10 on 10. So they are the wonderful people who have been working on this therapy. And this is just the beginning of our talk. I hope in future we will talk to them on so many dimensions. I will request them to come out with their case studies with specific areas, people, gender, age group, community, and people from all geographical area. She will share, and this will help people to understand how health is not a field wherein only the doctors with MBBS can cure the disease. If you really want the world to be free from diseases, you have to take help from all the specialists who have been working in various areas with their specialization. Thank you so very much.